Dear friends, welcome to the show, Talk with Your Doc. I'm Dr. Prashant Jani, and our guest for today is Dr. Mario Nucci. He is a family medicine specialist with special interest in the treatment of mental health and addiction disorders. And our topic for today is how to treat treatment-resistant mental disorders, in which Dr. Mario Nucci has done some innovative treatment modalities, and he's a pioneer in this field to talk about treatment-resistant mental health disorders. Mental health is a very prime issue, and every year more than 800 million people across the globe are affected with mental health conditions or mental health disorders, prominent among which are the stress, anxiety, depression, and it is one of the leading cause of socio-economic impact in the community. So we are very glad to have Dr. Mario Nucci here with us. Thank you, Dr. Mario, for coming and joining us today.
Dr. Jani, thank you so much for having me. Treating patients with mental health conditions is a passion of mine, and I'm very excited to talk about it, to spread awareness, and also to spread awareness about the treatment modality that we have to treat patients with treatment-resistant mental health conditions. So thank you so much for having me today.
Thank you for serving the community. You are doing a wonderful service in Northwestern Ontario. What sort of mental health disorders you see commonly in your practice?
Thanks for asking, Dr. Jani. So in my practice, I practice both in the inpatient hospital setting as well as the outpatient or clinic setting. And we see the full spectrum of mental health conditions. These can include mood disorders such as major depressive disorder, otherwise known as depression, bipolar disorder, anxiety disorders like generalized anxiety disorder, and social anxiety, panic disorder, PTSD, post-traumatic stress disorder, obsessive compulsive disorder, ADHD, and even schizophrenia. So we see the full spectrum in my practice.
We talk about this mental health and mental disorders. So what is the difference between the mental health and mental disorder?
Yeah, so great question. When we talk about a disorder or an illness, we talk about a deviation from the norm. And when we talk about normal health and well-being for the mind, we talk about a good mood, a good interest level in doing things, a good energy level, normal concentration and focus, free from worry, a normal thought form where thoughts are organized rather than disorganized. We don't have hallucinations or abnormal thoughts. And when we talk about mental disorders, we talk about symptoms that are abnormal that impact a person's day-to-day level of function.
Nowadays, I see quite a few people having this stress, anxiety, depression, very common nowadays, especially among young population.
Sure.
What is your experience with youth affected with the mental disorders, especially in Northwestern Ontario region?
Yeah, so it's a great question, and there are a lot of factors that are probably driving an increase in mental health conditions.
Among youth?
Among youth and among the population in general. We're coming out of the COVID-19 pandemic, and certainly there was a stressor on mental health there, but there are other factors, social determinants of health. We talk a lot about in medicine, where things like poverty, lack of supports, and other stressors can be contributing factors. In today's day, actually, social media can be a contributing factor, both in technology's weakening of attention and cognitive control, but also in social pressures that are exacerbated by the comparisons to other people. So that's just a brief discussion on youth and mental health today.
So you see quite a few young people affected with
very much so.
Very much?
Yeah.
What is the incidence of mental disorders in Canada as such, like say out of 100?
Yeah, so statistics say that up to a third of people in Canada will experience some form of mental health condition. With respect to depression or major depressive disorder, about 8% may have it at any given time. Post-traumatic stress disorder, for example, about 8% as well. Obsessive compulsive disorder, about 3%. anxiety disorders in general can also be up to a third of people will experience it in their lifetime. So these conditions are very prevalent in society.
So out of 100, say 30 people have these chances of 30 to 40 people having these chances of mental health disorder.
We'll have a mental health condition, that's right.
So are there any other factors other than the factors you described, like any genetic factors or any environmental factors or biological factors?
So it's a great question. And the exciting thing for a clinician like myself who's passionate and curious about the field is there is a lot more to discover. There is a lot more we need to uncover about how the brain works and how that translates into mental illness. So we have a model we call the diathesis stress model. So somebody has a predisposition and you subject that person to an environmental factor like a stress, for example, and that person will manifest with a mental health condition. So there's predisposing biological factors when met with the right conditions can present as a mental health condition.
So when you say predisposing, is that the family history you're talking about or genetic disorders? Or?
Certainly there is a lot of heritability or translation down generations with mental health conditions. We have some insight into some genetic and biological risk factors. For example, certain receptors in the brain that are involved with the signals being transmitted, the neurochemistry, certain variations of those may be more likely to present with certain mental health conditions in certain people. Certainly certain mental health conditions, for example, bipolar has a very strong heritability. So there are these genetic underpinning factors. We're not at the point where I can give you a genetic test or a blood test just yet to diagnose these. So our diagnosis is based on clinical history, but there is a certain underlying biological component for sure. One thing I should also note is that the connections between different parts of the brain also seems to be part of the pathology in mental health. And when we have interventions, we can see changes in some of that connections in the brain as well.
So somebody has, say, genetic predisposition or family history, and then there are environmental stressors, and that aggravates the mental health condition. Can we prevent that mental disorder happening in a patient with the predisposing factors?
So it's a great question, and there is certainly evidence now showing that a lot of the factors that we tell patients from a therapeutic perspective, these are things like exercise, things like socialization, things like stress reduction, things like spending time doing things you enjoy. Those factors that we use to treat mental health conditions tend to also be protective for mental health conditions. There's a recent paper published that showed that people who exercise actually have reduced risk for incidence of mental health conditions. So there are protective bio, psycho, and social factors that can be preventative. Yeah, yes. And they can also be treatments as well.
So that's very good information. We'll take a short break and we'll continue our discussion. So please come back for the next part of the show. Thank you. Welcome back to the show, Talk with Your Dog. Our guest for today is Dr. Mario Nucci, and we are talking about treatment-resistant mental health disorders. In the first part, we talked about mental disorders in general, causes, and how we can prevent it. And Dr. Mario Nucci, you were mentioning that exercise or some sort of social activities or some contribution to the community in terms of positive aspects can prevent mental health disorders.
Yes.
Do you want to add anything to that, like any meditation practices or yoga practices or some sort of reading habits?
Sure.
Anything which can help to prevent mental disorders in the community?
Absolutely. So emotional management and emotional regulation skills, some of which can be derived from activities like meditation, mindfulness, even yoga practices, can also be a great part of a mental wellness regime and a stress management program. So I absolutely do advocate for those things. One thing I can say is it has to be something that the patient will adhere to. So, for example, some patients may not want to do a meditation practice, but they may be someone who likes to do yoga, or someone who maybe likes to do painting or a gardening activity, or something that gets them into that mindfulness state without having it be a work-like exercise for them. So, as a clinician, my role is to try to find what works for the patient.
So, what are the warning signals to understand that now I'm going to have a mental disorder?
Sure.
There might be a very thin line between stress and the stress causing mental disorder. So what is that we should watch for?
Yeah, so that's a great question, and family members often ask me, how do I know if my loved one is having a mental illness or mental health disorder? And really what it comes down to is a persistent change from the person's baseline that impacts their level of function in a substantial way. And there are different domains of mental health, different domains of mental illness. And so we see those changes in terms of the behavior that changes and in terms of the way that someone expresses themselves. So for example, with mood disorders, we might see a flattening of the person's affect. We might see them less engaged in their day-to-day activities. We might see them sleeping more. We might see a change in their appetite, these types of things, or excessive worry and some of the manifestations of that on some of the other signs. So behavior change that's persistent and that impacts function.
So most of the people, like I would say 90% of the people would have some or other type of symptoms, one of these, right? But when it starts affecting your day-to-day lifestyle, you cannot go to work or you cannot do your activities, that is the time you go to the doctor probably?
Yeah, I would say if there's a concern, talk to your doctor.
Okay.
But certainly if it gets bad enough where your function is significantly impaired, then you absolutely should talk to a professional.
So among the professional treatments now, there are two types of people, one called psychologist and psychiatrist.
Sure.
So what is the difference and where do we go?
Yeah. So a psychiatrist is a type of physician. So this is a person who completed medical school that then went to do extra training in the treatment of mental health disorders. And these clinicians are able to prescribe medicines, are able to order blood tests, imaging, these types of things. A psychologist is someone who can be a clinician that does therapy, psychotherapy with patients for the treatment of mental health disorders. They can also do very comprehensive diagnostic assessments as well for patients. So both have their role in the treatment of mental health disorders.
So both work hand in hand.
Very much so.
So first we go to psychiatrist and then he refer to psychologist, or first we go to psychologist?
Patients can actually go to a psychologist as a primary intervention and a primary assessment measure for their mental health condition as well.
And then he will refer to psychiatrist probably.
If there is a need for things like medications, other diagnostic interventions, blood tests, these types of things, more comprehensive or different type of assessment, then the psychiatrist may be someone to get involved. But a patient can see a psychiatrist first or a psychologist. It can be either or.
We talked about mental disorders, but substance abuse disorders are also part of mental disorders spectrum probably.
Sure.
So when do we know that somebody has a substance abuse thing, like alcohol or any other drugs, or what is the...
Yeah. So again, the typical line to cross is, how much does this impact me day to day? How much is my day-to-day life consumed by the cravings and the need to obtain a substance? So certainly you could see that if somebody was thinking about alcohol all day long and they just needed to have that drink and it was impairing their ability to function at work and they were constantly thinking about chasing down that next drink, they've crossed the line into this is a disorder.
Yes, yes, yes. And the treatment options can be like a psychiatrist giving some drugs or psychologist giving some sort of a therapy. Is that the psychotherapy we're talking about? Or?
Psychotherapy is a first-line therapeutic modality for mental health conditions, for almost all mental health conditions.
So what is psychotherapy? Please explain it a little bit.
Sure. If you think about the brain's software, the automatic thoughts and thought processes that go on, these can be helpful and tilt someone towards mental health and well-being. They can also be harmful and tilt someone away from mental health and well-being and towards mental illness. And so if we change some of that software over time with psychotherapy, we can change how people think and behave and then how they feel. And
So
we can make
how do you do this? Like, so is it like a counseling, or what is psychotherapy like involved?
Broadly speaking, it involves two people talking and the elucidation or drawing out some of these negative thought patterns and then having someone gain insight and helping them to change those thought patterns and also changing their behavior in response to certain stimulations.
So there are different types of probably psychotherapies, and the duration of the psychotherapy varies
There are.
according to the probably treatment required, right? So
Yes.
somebody may need shorter duration, somebody might need longer duration.
Yes.
So these drugs and psychotherapy go hand in hand, and they help the patient to get back to normal. Does ever patient come back to normal?
So it's a great question, and a lot of patients will get back to normal. And certainly the goal is to try to get someone back to at least the ability to function day to day and to carry on as best as we can. And that certainly is the goal, is remission. Some patients may not be able to achieve that, but certainly we try our best to help them to achieve that.
What percentage of patients achieve normalcy in their life and did never have to go back to the treatment, just forget about it?
It's a great question, and we typically say that approximately a third of patients will remain treatment resistant. That is to say that the typical set of treatment options will not be sufficient to achieve remission in a particular set of patients.
So you said 1/3 of the patient might get resistant to the treatment.
That's right.
So that is treatment resistant
Yes.
mental disorder.
Yes.
We'll come back to the treatment resistant mental disorders, which is your specialty probably.
Something that I'm excited to help to treat these
Yes.
patients for
So
sure.
next part of the session, we are going to talk mainly about treatment-resistant mental health disorders and role of ketamine and psychedelics, in which Dr. Mario Nucci is pioneer and specialist in the region. So please stay back for the next part, which is going to be very exciting part. We're going to talk about that in the third part. Thank you so much. Please come back.
Thank you, Dr. Jani.
Welcome back to the show, Talk with Your Doc. Our guest is Dr. Mario Nucci, and we are talking about mental disorders, and now we are going to talk about treatment-resistant mental disorders. So, Dr. Mario Nucci, what is the reason that 1/3 of the patients don't respond to the treatment and 2/3 patients respond? So, what is the reason for the treatment resistance?
It's a great question, Dr. Jani, and my feeling is that the current mix of treatment options just doesn't get to the underlying biology of what's going on in the brain of the patient who is labeled as treatment resistant. And so it may not be that these patients are treatment resistant, they just haven't had the treatment modality that will help to change the pathology going on inside their head and inside their mind.
So, you mean to say that the particular type of drug is not working and then they need to change the medication or therapy, or?
Yeah, and so this is where my interest in new and innovative types of treatments comes along. So the traditional standard mix of treatments for, say, a mood disorder, we have SSRI type medications, otherwise known as antidepressants, for example. They may not work for all of the different types of presentations of depression that we have. And some of these other therapies like ketamine or psychedelic substances may change the neurobiology in a different way that helps to fix the pathology going on inside the patient.
So a standard treatment, which is the routine treatment, doesn't work, then you have some other options for them. That is called treatment resistant probably?
For patients that the standard mix, so to
Doesn't
speak,
work,
doesn't
yeah.
work for, we have options for patients who are treatment resistant.
Resistant. So when do you know that you are resistant to the standard treatment? What is like a sign or symptom, or how do you know?
Typically, we describe it as 2 or more antidepressant type medicines for a patient with depression, for example, or 2 or more medication trials, plus or minus psychotherapy. That would be someone we would categorize as treatment resistant.
So after giving 2 sets of therapy, patient is not improving, then you change the course of treatment?
We would categorize them as potentially treatment resistant, and we would look at how are we going to treat this patient, for sure.
So is there any duration, like when you say 2 courses means like 3 months, 6 months, how long is this?
If you've been on an antidepressant, for example, if we're talking about depression, about 8 weeks of a trial is a reasonable time period.
Couple of months.
Yeah.
And the patient doesn't improve, then you label them or you diagnose them as treatment resistant.
Assuming that we have the diagnosis correct. And this is where a good clinician really needs to make sure that they're sure about the diagnosis first. And once they've tried a number of options for their condition, if they're resistant, there are other options available.
So you mentioned that ketamine. So what is the ketamine and how does it act in the treatment resistant cases?
Yeah. So ketamine is a substance that was synthesized in the 1960s and is described as a dissociative anesthetic. It's been used since the 1960s in the realm of anesthesia, and it is widely used because of its safety profile in that setting. By that I mean that compared to other anesthetic medicines, it doesn't change your heart rate, your blood pressure, your respiration, so it's not considered to be dangerous. It's quite safe. In fact, we use it for children, say in the emergency department, where we want to reset their bone after a fracture. So it's very widely used safely and commonly in the anesthesia setting. What we found over the last 2 decades is low doses of ketamine help profoundly and rather quickly for even these treatment-resistant cases, to the point where up to 70% of patients who are treatment-resistant depression or even PTSD patients who are treatment-resistant, 70% will get a beneficial treatment response, which is quite high in the mental health setting, where traditional antidepressant medicines, maybe 30 to 40% will get a beneficial response. So we have this substance that has a rapid onset and a high effect size for a treatment-resistant population. And so you can imagine someone like myself who's very passionate about helping people with mental health conditions, you now have a therapy that can help them dramatically shift. And so I've seen patients where they've tried every medicine under the sun, have been bedbound for years. Now they're functional. Now they're in remission from their depression or their PTSD. And they're doing very well. And it excites me to be able to offer this to patients.
So how do you consume this ketamine? Is it like a tablet or
It's a good question.
syrup, or how do you give it?
Yeah, so traditionally it had been given in the form of an intravenous infusion. And you can imagine that for patients getting an IV infusion, there may be a bit of anxiety with that. And ketamine does have a dissociative effect or a bit of a mind-altering quality to it, and we have combined that with psychotherapy to further enhance the benefits, and I can talk a little bit more about that. And so we deliver the medicine via an intramuscular injection.
Okay, it's the injection.
And the intramuscular injection has the same bioavailability or the same effect as the intravenous. And it's a more palatable and more therapeutic way to administer the medicine for the patient.
How often one has to take this injection?
The standard protocol that's been discovered in the research seems to be that twice a week for 3 weeks, and then spacing out as able, with some patients requiring some kind of maintenance treatment. Others find that they don't need or they don't want maintenance, and we just observe them over time.
Is there any side effect of this ketamine?
So, other than restoring the mental functions and mental health functions in the patient, when you give ketamine to a patient in the acute setting of the medicine being in the body, there is what we call a dissociative effect. And so, what does that mean? It disconnects the thinking part of the brain from the feeling part of the brain, and so people can feel sometimes a bit spaced out. Some people will even have a profound spiritual experience with the medicine as well. And so this mind-altering quality is a side effect, but it's actually part of the effect for patients. And we can actually use that therapeutically for patients as well.
You also specialize in psychedelics. So what is psychedelics?
So ketamine can actually be considered part of the umbrella of psychedelic substances. Psychedelic substances are what we would describe as sort of mind-altering substances that broadly will cause a hallucinogenic experience. So it alters your perception so that you see and feel things that you wouldn't normally see and feel in a normal waking consciousness. These substances include things like psilocybin, colloquially referred to as magic mushrooms, also LSD, which is a synthetic type of substance, DMT, ayahuasca, peyote, these types of substances are labeled as hallucinogenic or psychedelic substances. And in controlled settings with a therapist, clinician, delivered to the right patient in the right way, they can have an incredibly profound positive impact on a patient's mental health.
So you combine that with ketamine and make it, or use one or either?
Yeah, you use one or the other. So ketamine has a mind-altering quality to it, and that can be profoundly beneficial for the patient. And these other substances can also be used for the therapeutic use for mental health conditions. Ketamine is actually what we would call the only legal psychedelic substance that we can use with patients. The rest of them are behind some red tape, so to speak, in order to use them with the patient.
And you have been using it in Northwestern Ontario for quite some time probably, and helping thousands of patients probably.
So with my team at the Canadian Centre for Psychedelic Healing, we've been using ketamine-assisted psychotherapy for many, many patients, delivering incredible transformative results that I'm very excited about. And our team is also trained in the use of psilocybin and MDMA-assisted psychotherapy for other patients with treatment-resistant mental health conditions as well.
And you are the only center providing these services probably in the region.
That is correct.
Thank you for doing this for the community. Really appreciate it.
Thank you, Dr. Jani.
Thank you for coming and guiding us with this novel new treatment for the treatment-resistant mental disorders. Thank you so much.
If anyone wants to know more, they can find us at ccfph.ca, Canadian Centre for Psychedelic Healing.ca.
Thank you everyone for joining us for the show. Thank you.